Hi everyone, and welcome to our webinar, Transferring Notified Bodies, How to Transfer Your Certification Between Notified Bodies. My name is Sarah Stec, and I'm the Legal and Regulatory Director here at LNE GMED North America. As many of you may know already, our organization provides certification and customized training services in the medical sector for markets worldwide, including Europe, Asia, Canada, Brazil, and Australia. Now, the decision to change notified bodies isn't one that a medical device manufacturer takes lightly. Sometimes it comes near the end of a long relationship where the manufacturer and the notified body decide to part ways. And sometimes it reflects the changes in the manufacturer's organization, such as a new acquisition or merger. Regardless of the reason, transferring notified bodies is a rather personal decision for a medical device manufacturer, and there are a lot of items a manufacturer would want to know before proceeding with it in the first place. Now, before moving on to our main topic, I'd like to go over a couple things. First, if you have any technical issues, please let us know by using our chat console, and we'll try and solve everything in the process. Please note that today's session is pre-recorded, so if you have any colleagues who are unable to attend, or if you yourself are not able to stay for the entire time, we'll provide you with a link to the presentation as well as a PDF of the slides later this afternoon. During the recording, I'll be here, as well as for about 10 minutes after the presentation to answer your questions. If you'd like to submit questions, please do so in either the chat box or the Q&A box that you see on your screen. Now, because we have an important crowd today, we'll go ahead and apologize in advance if we're unable to answer all of your questions. We'll keep track of all the questions and provide answers to every single one of them within the next couple weeks. If you have any specific questions you'd like to discuss, you can either email us or give us a call using the email address or the phone number on the last slide. And with that, let's get started. Today, we're going to go over a few things related to transferring notified bodies and the guidance documents that medical device manufacturers can use when thinking about transferring their notified body. First, we'll get into how transferring works, the type of documents notified bodies need to actually do the transfer, and the associated timelines. We'll also touch on what manufacturers can do with their labels, as the change of notified body would prompt the change of labeling as well. Then, we'll go into why a manufacturer would want to transfer their notified body in the first place. And finally, we'll touch on the different guidance documents that manufacturers can use when they're thinking about transferring notified bodies. These publicly available guidance documents can help to explain the notified body's point of view and to understand the manufacturer's own requirements. So now that we know where we're going, let's get started. Let's take a look at how transferring works and some particulars with respect to transferring. On this slide, you'll see the general process that notified bodies use when transferring clients amongst themselves. Now first, the notified body would assess the transfer file, which we'll talk about in a little bit. The notified body assesses it to see how many outstanding nonconformities there may be, what the nonconformities are, and it looks at the overall feasibility of taking over the certification. Second, the current certification or notified body is contacted to get their take on the certification. This step is probably the most frightening for medical device manufacturers, especially those who have a rather acrimonious relationship with their notified body. Now, to relieve that, I should tell you that notified bodies have a duty to be nice to each other. We have working groups together, we work together in conferences, and so it's all in the notified body's best interest to be harmonious with each other, especially in a business setting. In fact, the Medical Device Directive gives notified bodies the duty to collaborate with each other and share the same goal, which is to make sure that safe and effective devices are put on the market. Third, out of the assessment, the Notified Body Certification Committee will give their opinion as to the certificate transfer. If this opinion is favorable, then the manufacturer can send their, now officially old, notified body a resignation letter and converse with their notified bodies as to when the certificates will actually expire. At this point, the certification committee may also determine that an on-site audit is necessary to confirm the transfer. This case could happen if, for example, there were a lot of nonconformities or there were missing documents from the old notified body. If certificates are issued, the manufacturer and the new notified body will plan the next on-site audit, or additional audits and assessments as needed. Now, on this last point, some reasons why additional audits and assessments would be needed are, for example, if the old notified body had planned them anyway, or if there were a large number of nonconformities to be closed. Now, once all of that is done, then the transfer is complete. So that's sort of the high-level overview of the transferring process. So now that you know the process, let's talk about some of the transferring specifics and some tips. First, a note about transferring and how notified bodies look at it. When transferring certifications between each other, the notified bodies are assuming each other's certification. The new notified body doesn't have the history that the old notified body had with the manufacturer, and so it has to do its own due diligence. Before signing the certificates, the new notified body needs to check to make sure that it should. As a result, the new notified body is going to ask the manufacturer for documentation in order to support its own certificates for the products. Now, I should say that it can happen that the new notified body determines that, based on the evidence in front of it, it can't transfer certificates. In this case, the new notified body wouldn't go forward with a transfer and instead start the certification process from the beginning with an initial certification. Now, this usually happens when there's not enough evidence about the device or the manufacturer's quality system in the first place, or there are too many critical nonconformities to fix before a transfer could be completed. Keep in mind that the new notified body is also trying to do its own due diligence because of its duties to the public health. So it's nothing personal, we promise. Now, two documents that the new notified body must see are the audit reports and the certificates for the quality management system, and the product that is being transferred through the previous certification cycle. This is so that the new notified body can get a view on the certification cycle so far, as well as see if there are any issues that need to be taken care of ahead of the eventual transfer. Also, since notified bodies may differ in their auditing practices, the new notified body needs to see what the old notified body covered and how it covered it to see if there's anything that it would need to pay special attention to in the coming audits. The audit reports and certificates include the corrective action and preventive action plans, or the CAPA action plans, that the manufacturer generates to fix the perceived nonconformities. As it would be the new notified body's responsibility to see the manufacturer implement its CAPA action plan, it's important that the new notified body knows what it is. Along with the CAPA action plans, the new notified body needs to see any adverse events reports since the previous audit. This is so that the new notified body, as well as the new manufacturer, can be sure that the manufacturer's post-market surveillance system is working as it should. As a result of the new regulations governing notified bodies, they're going to take a deeper look at manufacturers' adverse event reporting in order so that they have a greater role in market surveillance. The first point on this slide is that the new notified body should receive a letter from the manufacturer to the old notified body that gives the old notified body permission to hand over information to the new notified body. Notified bodies need to corroborate the reports that the manufacturer gives them with the information from the old notified bodies. However, because all notified bodies have a duty of confidentiality, no notified body simply hands over their customers' information to anyone that's not a competent authority, and that includes other notified bodies. So, the new notified body needs permission to get the information that it needs from the old notified body. When the manufacturer is thinking of transferring, it's important to have at least a rudimentary knowledge of the transferring process in order to build up a concrete plan. Likewise, it's important for a manufacturer to follow the new notified body's schedule. Notified bodies all have processes that kick in when transferring, which need a little bit of time to work through. Notified bodies can also only transfer valid and up-to-date certificates. So, if your certification is about to expire and you know you want to transfer, you may want to start thinking about how you're going to transfer in order to avoid a situation where you aren't able to transfer because your certificates would expire while in the transferring process. If your certificates are about to expire, then your almost new notified body may want to wait for them to be renewed in order to actually go forward with the transfer. While this means that the manufacturer would have to go through another audit, the alternative is that the manufacturer would have a break in its certification cycle, which nobody wants. So it's important that the manufacturer take a good look at their schedules and make sure to plan enough time in advance for the transfer to go through before its certificates expire. So now, when is this whole process complete? Well, once the new notified body issues new certificates and the old notified body transfers the old certificates, the transfer is complete. In other words, it's on the date that the new certificates begin. These new certificates are aligned with the cancellation date that the manufacturer provides to the old notified body. Now, another reason to plan is because two notified bodies can't certify the same product, and the manufacturer can't apply to two notified bodies for certification of its product at the same time. So, it's important to coordinate the effective and cancellation dates between the two notified bodies to make sure they line up correctly. For devices that would require an EC type or design examination, there are a few more documentary requirements. These conformity assessments require a separate review of the device's technical documentation, in addition to auditing the manufacturer's quality management system, and so there are more documents required for the new notified body to transfer their certificates that go along with the type and design examinations. First, the new notified body needs the entire CE marking file, or the technical documentation as a whole. Second, similar to the audits, the new notified body needs the copies of the initial or renewal evaluation reports. Third, the new notified body needs to be notified of any modifications that were made since the last evaluation, including those evaluation reports if there was an additional evaluation. If there weren't any additional evaluations, then the manufacturer should make a statement accordingly. Finally, the new notified body needs to receive the date until which the old notified body's number will be on the advertising and labeling materials. I'll explain it on the next slide a little bit, but the manufacturer and the old notified body would come to this determination. So now that we talked about the process and a few tips and explanations about the process, let's touch on a topic that every manufacturer asks us about when they're transferring: labeling for their existing stock. It isn't very often that a manufacturer will sell all their stock as they manufacture it, and so many manufacturers have stock left over, waiting to be sold, bearing one notified body's number. However, when the company transfers notified bodies and the new notified body takes over that certification, the old notified body number shouldn't be on the medical devices that the new notified body certifies. So what should a manufacturer do? So does this mean that they have to go and relabel all of their stock? Well, not necessarily, no. It's important that the manufacturer coordinate between the old notified body and the new notified body. Sometimes a notified body will give the manufacturer a date or a batch number, after which the certified devices should be labeled with the new notified body's number. So this includes those devices that could be in the manufacturer's stock in the first place. So, The old notified body and the manufacturer will come to an agreement about the date or the batch that finishes the old notified body certification. The new notified body's information should then be on the labeling for devices either manufactured after that date or batch. This could mean that the manufacturer may need to relabel some of the devices that it has in stock. Depending on how the manufacturer's quality system and distribution chain is structured, this may mean that the manufacturer needs to make sure that their packager or distributor follows the manufacturer's instructions. So this is an important step, and it's important for a manufacturer to really coordinate between their old notified body and the new notified body, so that way they don't have to relabel everything if they don't need to. So now that we've gone over how to transfer and some pointers and explanations on transferring, let's talk about why a manufacturer would want to transfer in the first place. This slide and the next talk about two of the main reasons why manufacturers would transfer their notified body, and they both have to do with consolidating their certifications with one notified body. First is when the manufacturer has some corporate changes, like they merge or acquire another company, or their subcontractor who has had their own notified or certification body. These corporate changes can include things like name changes and management changes, which can directly impact the quality management system for the device and the device's conformity to the essential requirements. For example, when one manufacturer acquires another, the manufacturer may have more sites and product lines than they did before. These new sites and product lines should be incorporated into the new manufacturer's quality management system. Once the manufacturer determines who the legal manufacturer would be for each of the devices, it can make the decision to consolidate all of their certifications under one notified body. This, naturally, means that it may need to transfer some of the acquired devices to a different notified body. A manufacturer doesn't necessarily have to transfer the acquired devices, but in this situation, many do in order to have fewer audits and generally an easier and more predictable way to communicate about the devices. Another example of when a manufacturer may want to consolidate its certifications after a corporate change is when it acquires another manufacturer product line and wants to expand those products into new markets that they weren't in before. Not all notified bodies have the international presence that many manufacturers require, including market access to Canada, Japan, and other major markets. I should say that GMED is a Health Canada accredited registrar, and it's also accredited by Inmetro in Brazil to offer the testing requirements for electromedical devices going to Brazil, and it offers market access to Japan as well. Now, these markets are in addition to the EU, and so GMED is a natural choice for many manufacturers when consolidating their certifications. A second main reason why manufacturers transfer notified bodies is because of their evolving product lines. As medical device manufacturers grow and add products and product lines, its original notified body may not be able to grow along with it. This is because not all notified bodies are notified for all directives, products, and conformity assessments. This is especially the case for high-risk and specialized products, like combination products and products that incorporate products of animal or human origin. Now, I should note here that GMED is notified for all directives and their accompanying products and conformity assessments, now including the very specialized products like products of human or animal origin, combination products, and even nanomaterials and devices using micromechanics. While there are many more reasons for transferring notified bodies, the last reason that you'll find here are the new regulatory requirements that may make some enforced or involuntary transfers. As you may have already heard, notified bodies have some new requirements and must undergo audits and inspections that they didn't before. According to a new regulation issued in September of 2012, notified bodies will have to conform to more prescriptive competency requirements. Joint inspections, where a notified body is audited by its own competent authority, along with other competent authorities, resulted in 4 notified bodies losing their notification last year. In this case, where a notified body loses its notification, the notified body should coordinate with another notified body and its clients to transfer its clients' certifications for them. Now, not all notified bodies are in such dire straits. GMED, for example, showed its commitment to quality at its own joint inspection last year. In addition, GMED is an author and a signatory to the Notified Body Code of Conduct, in which it voluntarily commits itself to a high level of quality, depth, and diligence of the work that it carries out. So far, we've gone over why a manufacturer would want to transfer notified bodies, the process for transferring, and some tips about transferring notified bodies. On this next slide is some guidance documents that manufacturers can use for more information about the process, including documentation that the notified body may need and what notified bodies are looking for when starting the transfer process from their perspective. I will send out a PDF of the slides, and so you'll have these links for your reference. And here they are. So the first 3 bullet points you'll see are the 3 major directives: the Medical Devices Directive, the Active Implantable Medical Devices Directive, and the In Vitro Diagnostic Medical Device Directive. The NBOC 2006-1 is the NBOC Best Practice Guide, and that specifically deals with transferring notified bodies, and it talks about voluntary and involuntary transfers. And finally, you'll find the mandatory document for the IAF talking about transfer of certification. And with that, we can wrap it up. Like I mentioned, I'm going to stick around here for the next 10 minutes or so to answer any and all of your questions. So please feel free to type them into the Q&A box that you see on your screen, or into the chat box. If I don't get to your question, don't worry. We'll collect all of the questions that we don't get to and send out the answers in about a week. Thanks again for coming.